What is your name?
My name is Nansat Marquis and I'm coming from Vasco. And I got to know about this center because of my aunt who had come for treatment.
Hmm.
And
What was your problem?
I was suffering from asthma and sinus
From when?
from the time I was in 5th standard.
Hmm.
Yeah.
So what was your condition when you came here, and how much you were suffering?
I used to get attacks every night, and I used to take that Cipla Rotohela. Twice a day I used to take that tablets. And if I don't take it, it wouldn't stop. And because of my sinus, the asthma would become even worse because whenever I sneeze, soon I used to get an attack.
So sinus also was suffering from childhood.
Sinus was from childhood. Yeah.
What was the condition of sinusitis?
Very bad. Every morning I get a cold every morning, and if I have bath on head, I definitely. Then I used to take this Corex syrup or Vicks Action tablets and all. But after I came to know about this acupuncture and I started the treatment, I don't take any tablets, not even the Cipla Rotohela, which I used
Just
to
tell
take.
me first, actually, what was your condition when you had the attacks and all? Because people let know about how serious your condition was.
See, if I tell you about asthma attacks, like if I tell you it's an attack, nobody understands. But if you want to know how it feels while asthma happens, take one pillow and keep it on your face where you breathe on your nose, and your breathing slowly stops. It's like that. And when you're in your deep sleep in middle of night, not 2:30, suddenly your breathing stops. And when your breathing stops, you want to do anything but to get your breathing back. So I used to take these inhalers and all, and it used to give relief.
Then you was also admitted many times.
Many times. Then I also took injections, these steroids in my nose when I was small in 6th standard. And this thing would give me relief for 2 months, but again it used to start.
Then what more things you have done, and what are the which doctors you showed me where in Goa, and also you told me sometimes you have seen so many doctors.
I've seen many doctors from childhood. I used to go to this family doctor of Dr. Costa. He used to give us injections. Anytime at night, my father used to, if I get an attack, he used to take me straight away at night and give me injections. And then only it used to stop.
Your life was very horrible then.
Horrible. I could not go to, since school, my teachers used to not take me in sports. They used to not take me for camp. They used to not allow me on fields. Then I could not do any physical exercise, nothing. But now I can. I even go to the gym now.
How many days you have taken treatment? After how much treatment you got relief?
On day 1, I got relief. I saw that I slept well. And I didn't get an attack on day 1. And then now it's 4 months I've been taking treatment, and I'm not touching also that inhaler.
And no medicines?
No medicines at all.
So from when you stopped the inhaler, after how many days you was able to stop inhaler?
I was able to stop it after like 15 days. I used to get it once I used to take since I started treatment. But now it's total. I don't even take it. Yeah.
How is your life now? Because see, asthma with the tablets and medications and inhalers is a very worse life. Means you are not getting normal life. You are not never lived a normal life.
No.
Always with the breathing problems and inhalers.
Yeah.
One inhaler also, if you stop, you told me that you cannot go ahead.
I cannot.
Yeah, and regular you are taking inhalers, and you told me also then there are a lot of additional puffs also required when you get more severe attacks.
Yeah. He used to put me some sort of, it's sort of a oxygen, I don't know what it's called.
Nebulizer.
Stimulator, yeah.
Nebulizer.
Yeah, I used to take that. And when I used to get asthma and sinus, with that only it used to stop. It was sort of some gas, I don't know what it is. Yeah, and it was like very bad. I could not do any physical exercise or don't have cold. Now I even have cold. Cold water and all.
So after coming here, now you are living a normal life.
Yeah.
For last 4 months.
Last 4 months.
No medication.
Nothing.
You are stopped after from childhood. Means how many years age you are now?
Now I'm 25.
So 25, almost
Yeah.
20 years
Almost 20 years.
you are taking medication, and
Yeah.
that 20 years addicted medication we
Yeah.
were able to stop within a just 15 days.
Yeah, I would say on day one.
Day one.
Yeah.
So all the medication you stopped after
Yeah.
first day treatment.
First day of treatment.
Yeah.
Yeah,
So
because another thing what used to happen with inhalers, like there is a certain, like if it's a strong tablet, once my body used to get used to it, I had to take little more stronger and little more stronger. You know, so it
go
was
on
like
increasing the doses.
the doses. Yeah.
Uh-huh.
So this used to worsen, and other thing, there's no option because if your breathing stops, what else do you want? You will try to take anything, right?
So what you want to advise to the people now? See, now you are taken experience, we are taking so many asthma cases.
Yeah.
Because before for asthma and sinusitis, we were also not having treatment in our acupuncture as a cure is concerned.
Yeah.
But after our research,
Yeah.
now so many years we are treating cases
Yeah.
where totally patient get totally cured.
Yeah.
Without any problem, they live years together,
Yeah.
and they come to and meet me that doctor, I am till today totally fit and
Yeah.
fine. So now your case, what your advice to the people? Because people never believe about acupuncture science,
Yeah.
because we have done lot of research in our center. Leave about the acupuncture going on in China. They are also going symptomatic relief. But what we do in our center is maximum root cause treatment. So once patient is treated, till today at least we got the result that people have not relapsed with the disorders.
One
Yeah.
thing I would like to tell all the patients and people who are suffering from asthma or anything, there's no doctor in the world who gives you guarantee of treatment. Nobody will say I will cure this.
Yeah.
Nobody will give his word.
Yeah.
They'll say okay, I can control it, but if someone can say this, no, it's only Dr. Prabhu who can say this, because he's done his work and he's done his research, and then he's come to this conclusion. And that I'm not just saying for anything, but I've seen it on my own body. And
You are saying your auntie also has been treated in our
my
center.
auntie also has been treated. She could not walk. She had fallen down from a staircase, and now she's walking very, very comfortably. So because of her, I came here, and thank God of doctor.
Because asthma is such a difficult disorder,
Yeah.
where it will stop with your life.
Yeah.
I have seen my own father-in-law and his death in front of my eyes,
Yeah.
and I was not able to do anything because their asthma we were not having answer that time.
Yeah.
Because of his full family as a hereditary, they got the asthma problem, and everybody was suffering at the small age also.
Yeah.
So we started doing research on them, and we started getting result also.
Yeah.
And then we handle lot of cases who are having continuously per day even 6, 7 times puff, and they are going with the horrible life. Every time now and then they should be admitted in the hospital and so many things.
Yeah.
Means it is not a normal life at all.
It's
now
not a
4 months life of yours now after treatment, because I will be treating you for 1 year to complete your full 1 year.
Yeah.
All the anti-allergic power I am to bring in your body, because every month there is allergy problem,
And
every time there is climatic changes full year. So every climate damages your asthmatic problem. So we want to overcome all these climatic conditions. So most of my research, what I try to do, even if patient is totally cured, I try to give them total 1 year treatment and 1 month more or 2 months more,
Yeah.
so that we can complete full 1 year cycle. In that full 1 year, there are different climatic and atmospheric condition changes, and I want to make you totally strong against these conditions.
Yeah.
And then once you are completed this course of 1 year, patient get totally fit and fine. There are so many patients also, because of some of the other reason, they were not able to complete after 6 months, but I have seen they are totally living normal life. But sometimes few patients may come back.
Yeah.
Because of that reason, we don't want to take risk of asthma patient that he will again suffer.
Yeah.
So because of that, we advise patient to take complete 1 year and 2 months treatment,
I know.
so that you will get total rid of this lifetime problem.
And about inhalers and all, no doctor tells you what are the consequences. When I came here, doctor told me that inhalers they give you temporary relief, but they are doing permanent damage in my body internally. And what doctor was doing is regrowing my cells now, and I could feel the difference. And like asthma is like when you get an attack, how someone gets an attack, his lungs they get swollen up and they slowly block your windpipe. So what inhalers do, when you take inhaler, they release this.
Yeah, only the dilation of your bronchioles are slightly dilated, and so that you can breathe more.
And this is like temporary.
Yeah.
But what doctor does is he gives you, he grows your immunity from inside. Internally, he makes you strong.
It develops your cells, and internally we try to remove the things toxics out.
I didn't know all these things about asthma. I knew only, okay, if you have cold, you get an asthma. But what are the consequences? Why it happens? Nobody tells you this. They tell you, okay, take tablets. But what happens?
So we try to give the knowledge of how you are suffering, why you are suffering. And that is the why the patient knows what is the condition of the patient and what you are actually living with the tablet, what is the life actually. And then we try to treat, because without giving you full knowledge, I never treat any patient, because unless and until you have knowledge and confidence about what you are taking treatment and faith in the treatment and doctor, that will work more than the treatment. That's what I believe actually. And because of that, I tell all the things, also see the pulses, what are the reason behind your asthma, because every patient asthma is different. So what is the reason behind your asthma, I tell them. Also I tell them the diet which is necessary for that as per the pulses. Accordingly he can keep his life normal. That is also one more thing is very much essential. One more about asthma and sinus, just now what you were telling about how it again recurs. As per the research also, as abroad research is there, I have gone through the research. Even they have now proved that when you get sinusitis is the main reason behind the asthma. Because first you get sinusitis, cold. Then you try to take drops. You put the drops in the nose and all. Those drops itself is the reason behind the asthma and lungs to get the problem. What they have come to the conclusion. So now they stop giving the medications of nasal drops and all. So these are the reasons where they slowly go interact with the bronchioles, and then those bronchioles they start getting the problems. Again, once you are actually taking the puff, they are actually dilated, means they get more space, or your tubes are free. Again and again, when you just open it, they are just like, we can say example like rubber. If you just open it again and again, then they sometimes get stick to each other. And again, this type of problem, the elasticity, you can say, it is reduced, and then you get more and more problems of lung, and you get recurring attacks. And then one day you will find a COPD, or your lungs are totally collapse. So these are the problems occurs because of the medication, what the foreign reports are telling about. So in our center, what we try to do is root cause. Why the lungs are getting damaged? Who is the responsible for the lung damage? That particular organ should be treated. In every case it is different. So accordingly we treat the organs which are damaging the lungs, and then it becomes a root cause. Only treating root, and if the organs which are responsible for damaging the lungs are not treated, then you will never get treated. That is what I have seen. So this is I have taken special report about the asthma special recording with you, so that we'll know what is the condition, and people should know about what is asthma. Because asthma is well known, and people never will believe that it can be cured. And nobody, if we tell also, they never believe that asthma can be cured. But you have seen, and we are seeing regularly in our center, patients are getting totally cured, totally getting rid of the problems, and they are living normal life. That is very important. You are now living also normal life.
Very normal.
With when you know what at the time of medication you was living, but still while walking also breathlessness will be there. Slide walking you will get the breathlessness, again and again suffocation. If you just climb the steps, you will have the total breathlessness will be there. This is not there at all now. You have tried everything.
I've tried everything.
Tell me what you have tried more.
Now the thing is that I go to the gym. First I used to not go. Then I go for cycling also in the evening. I don't get attacks. And best thing is I sleep well. Otherwise at 2:30, 1 o'clock, when in your deep sleep, like someone wakes you and chokes you like this, that stops. That is the best thing. So
meanwhile you told me that you also tried with the cold drinks.
I tried cold drinks. I drink cold water.
Because I actually advise not to take. But still people even are working in the AC now. Lot of my patients, they are working in the AC. They are also drinking cold drink. They say they are living normal life. So that we are not thought of
Even
actually.
AC, I used to soon get attack.
Yeah.
AC.
But now you sit in our AC for
Yeah.
hours together.
I don't get anything. I don't even sneeze.
Yeah.
You know.
Yeah. So the sneezing was too much for you in the morning.
Soon, every day. Every day. It was like a temporary thing in me. I used to get like, and then it used to stop later. But then if
you are habitual to that sneezing regularly. How many sneezing per day? Morning
it used to be like for half an hour, 1 hour.
Continuous sneezing.
Then I used to take this correct syrup. Or I used to take Vicks Action 500 or D-Cold. I used to take those things. And I used to sleep at night only, first only. So then
morning you will not get. Just to prevent that, you have to take in advance medication regularly. Okay. Anyhow, I have taken your recording after just 4 months treatment. That is 4 months means not 4 months. People also sometimes think 4 months means continuous 4 months. No. We are giving 10 sittings in month. The 10 days continuous treatment in month, that is maximum 40 sittings. Just in 40 sitting you are living normal life. But as you told me, after just 15 sitting you are living normal life. So this is a main experience of your experience. Also, if you can bring your X-rays and before reports what you have been you got, so that people should know that you have been really asthma patient. Because sometimes we do this recording and lot of people also comments that maybe this recording simply taken. So because of that, recently we started recording their reports, their prescription, so that people will know he is a really patient. So I am just advising you, if you can come next time with your all the prescriptions, X-rays and lot of things what you have tried for 20 years. We will just record it to display it to the people, so that it will prove that you are really asthmatic patient and now you are free from that problems. Okay, thank you very much.